McGill curls, or McGill curl-ups to give them their proper name. So again, what we're trying to do with this exercise is we're trying to work a particular component, and that component here is basically working on sagittal plane or front to back stability and learning to develop that brace skill. But also, again, like with all McGill exercises, we're working on more than one thing at a time, whether you realise it or not. So when we do a McGill curl, also, we need to be familiar with the bracing technique. So one way to practice that, if you're not sure, if you find your belly button, and then just trace out to the sides by sort of 5 or 6 inches, take our fingers here, and we're going to sort of stab ourselves into our guts, and then tense the muscles here. You should find, if we tense those obliques properly, it pushes the fingers out. So again, relax, you're sort of stabbing yourself, then fight your fingers. There, that's that bracing technique. So when you first start, you need to learn how to do that without it kind of affecting your back or leaking into your back. So maybe just practicing that is going to be your starting point. But once you're happy with that brace, understand that concept, then we can actually look at a McGill curl up. So the setup is, we always have one leg up, one leg down. Reason being is that gives us in theory a neutral torque on our pelvis. If we have both legs up, we're inclined to drive our spine into the floor and slip into flexion. Have both legs down, we're prone to go the other way and kind of have a bit too much extension, which could be an aggravator. So in theory, one up, one down is going to put someone in the middle. So just pay attention. If you've got sciatica, you might find when one leg's up versus the other, it's a bit aggravating. So rather than switching between which leg is up between sets for you, just stay with whatever feels the safest initially for you, is not giving that sciatic irritation. So the traditional way of doing McGill curl, one leg up, one leg down, we take our hands and we slide it underneath our lower back like that. And what that does, it stops us from kind of like driving our, or flattening our back into the floor and slipping into flexion. Gives us kind of a bit of a feedback to make sure we're staying in neutral. The downside is with this, that I've found in the past 5 years, is that everybody's upper body posture now is so terrible, and their shoulders and neck are terrible, that just doing this makes their shoulders feel tight and uncomfortable. So what I've done is I've started to modify it for me, to actually use your abdominal raking a bit more. The trade-off is then you haven't got that insurance policy for protecting your lower back. So what you can do if you need to, is take a towel or something similar and just fold it up so it's roughly the thickness of about your fingers, just to give you that little bit of feedback to stop you from kind of flattening yourself into the floor. But I found for a lot of people that actually do need to do that. Once they know where neutral is, they're pretty good at like not letting it drive into the floor. But if you need to, give yourself a little bit of support. Again, it only has to be about as thick as your hand, what your hand would be like. But what we do now is we're going to use this abdominal raking, as it's called, or stabbing yourself with your fingers to set the brace first. And then it's a tiny movement off the floor and 3 deep breaths. And down. So what I'm not doing is going throw myself off the floor. There are variations, and Dr. Andrew Lock uses a variation where people lift their head, but that's particularly to get a bit more rectus abdominis to fire. What I found for a lot of people that I deal with is they spend all day looking down at screens and phones and all sorts. So if I crank their head up like that, it's going to give them more neck problems. So what I want to try and do is minimize the amount of head lift that we've got involved. So again, it's the brace, tiny movement of shoulders, elbows and head off the floor, and 3 deep breaths. Now again, because it's a McGill exercise, we're not just working on that brace, we're working on a couple of other things at the same time. Probably the most important one is learning to separate breathing and diaphragm from that brace. Because if you come up and try and hold, with the diaphragm, it's going to get very uncomfortable very soon, and you can't really hold it down. So what we need to do is better can switch on that brace, but like I've got my brace on now, but I'm still talking to you pretty normally, and I can breathe pretty normally. We'll learn that level of skill. So the brace stays solid, we come up, it stays on the whole time, even though we're kind of breathing underneath it. It's not really being affected by our breathing, so learning that skill is very important. Also now, again, like with the past 5 years with people with more neck and shoulder problems because of their disgusting posture, it actually becomes more of a neck conditioning exercise. So for some people, they get issues in their the rear of their neck because they're basically clamped on their traps too much. What you should feel is we should feel the muscles in the front of your neck starting to work, and we can use that for a lot of people. That's probably going to be the fatigue point more than the braces. And I think to note as well is once you start kind of going through or starting to get competent, you might go through a weird phase that you're doing the movement, and you get this kind of stuttering, and that's your body trying to work out how to separate your diaphragm, your breathing from that brace. It's not a bad thing, but I've noticed quite a lot of people sort of go through that phase for a couple of weeks, and all of a sudden it levels out and they kind of really get it nailed. The big points are, learn to use that brace first, brace it, small movement off the floor, 3 deep breaths. And we're trying to aim for sort of eventually 3 sets of 8, but start where you need to start and then very gradually build those numbers up. But again, learn that brace technique, learn to separate from your breathing. That's probably the most important thing to get from this exercise.